Welcome to Compassionate Conversations. The goal of our podcast is to explore topics related to serious illness. Ancora Compassionate Care exists to be a supportive presence for life's journey. We can provide care and support wherever a patient may be on their journey with a serious illness. Ancora Compassionate Care began as Hospice of Rockingham County in 1987. While our name changed in late 2023, we are still the local provider the community has always known. We'll always be there because we've always been here. Welcome to this edition of Compassionate Conversations. My name is Lynn Flanagan, and I'm the CEO at Ancora Compassionate Care. Flavel Collins is joining me today, and she is our Director of Marketing. Thanks so much for being here.
I appreciate the opportunity.
Yeah. You have joined us before, and we are grateful to have you back again. How in the world we are in July, I have no idea.
No clue.
But of course, major holiday in July. We think about celebrating the 4th of July, which is our country's Independence Day. So in thinking about that, we think about independence. That brings about thoughts of freedom, which makes me think about choice, all of those things. What I would like us to talk about today is really thinking about independence and our seniors here in our community, because independence can have a very personal meaning, right? As we all get older, as we age, the majority of us want to, what I would refer to as age in place. So independence for our seniors may look like something along the lines of choosing to remain in their own home, living life on their own terms, dignity, peace of mind, all those things. So let's talk some about how Ancora Compassionate Care can help support our seniors when you think about independence from that viewpoint, if we will.
Sure. Well, I think, first of all, when we think about independence, and as you said, aging in place, thinking just from my perspective when I look hopefully many years down the road, but I want to be in my home. I want to do things my way. I want to have a say-so in what's going on, whether it's my care, again, my way.
Sure.
And I think Ancora Compassionate Care can certainly support all of those concepts for seniors at home or wherever home is for them.
And that's an important point. We'll circle back to that, but I think you are right. And I think, when you said let's look many years down the road, let's just start right there, because we don't have to be seniors to really start thinking about things along those lines, right?
Right.
How do we want things to go? And you read all these statistics that the majority of Americans don't want to die in a hospital. They don't want to die in a skilled facility, but yet where do the majority of Americans pass away?
Ironically, to be prepared, I just looked up those statistics a little bit ago, and 70 to 80% of Americans say they want to be able to be at home.
Wow.
And yet the sad next page to that statistic is only about 30% die at home.
So, of course, there's a ton of factors that play into that, but I really want us to focus on choice. Let's think about planning. We plan for everything else under the sun, right? We're talking about 4th of July. There's a ton of people that planned for that holiday celebration. We plan graduations, we plan weddings, we plan baby showers. What we want in our health care, we should be able to plan as much as possible. Sure. So you were talking about you wanted to say so. You wanted to, sounds like you want to be in charge.
I do.
I understand. I feel the same way. And I have a whole list of things that my family's very used to this by now. It's like, I would like this, I don't want this, but that's important. That's part of my independence and being heard. Mm-hmm. So Ancora Compassionate Care, of course, has several different service lines now, but people would probably be surprised to hear that our hospice service line could actually help support them in all of these levels of independence we just talked about.
Right.
So let's just hit this head on, if you will. Most of the time, there's a negative connotation or a fear when you use the word hospice. Would you agree?
I would absolutely agree.
Why?
I think because, understandably so, when people hear hospice, they immediately think death and dying. We don't do death well as a country. Mm-hmm. So I think there's so many negative connotations and stereotypes around hospice. And the fact that we often get very late referrals give people the impression that it's only for the last week or 2 weeks or 1 month, as opposed to could be 6 months, 8 months, 10 months. So I think people hear hospice and they immediately think the end. And that certainly is not always the case.
Absolutely. And that's a huge myth, that it has to be right at the very end. You know, the hospice Medicare benefit, of course, was created as a 6-month benefit. But those who we are fortunate enough to care for early in this process, we may have them even longer than 6 months. We've had patients 9 months. We've had patients a year. Of course, as long as they remain medically eligible for hospice. So something else that I hear people say sometimes in the community is like, oh gosh, well, don't call hospice, and you're just giving up. Mm-hmm. What would you say to that?
I would say you're not giving up. You're making a decision, a conscious decision, to seek quality of life, comfort, dignity, usually in your own home. Mm-hmm. It's not giving up. It is more taking control, really.
I love that. So let's explore that a little bit further. So taking control, how?
You're taking control of your environment, mm-hmm. whether that's your physical home, but it could be the small things. You know, if you're in your own home, you have control of how loud the television is.
Right.
You know, often, you know, in a skilled nursing center, you're probably going to have a roommate. You might not necessarily want to watch Wheel of Fortune at level 30.
Exactly.
Every night. Right. But that might be what your roommate's doing. Mm-hmm. But, you know, there's control over, maybe your pets are with you right there in your house. That's important to me. Mm-hmm. So there's a lot of control, and it's not giving up at all.
And you know, when you think about the level of support that comes, so if once someone is utilizing our hospice service and they have this entire team of people, so you have physician, you have nurses that are available 24/7, social workers, chaplains, mm-hmm. hospice aides, and volunteers, all with you, if you were our patient, you're in the center. So there's the control, and there mm-hmm. is the choice, because we don't come in to dictate how things mm-hmm. are going to go for you. We come in to listen. How do you want this to go? What support would you like to use? And how often?
Right.
Right?
I mean, we have patients that say, I don't want to see the nurse but once a week. Okay. Or I don't need a chaplain right now. Okay. You know, we talk so frequently about an individualized plan of care. And if you've seen one hospice plan of care, you've seen one hospice plan of care. Right. Because it is patient-focused, patient-centric, what matters most to them matters most to us.
And that's important when our team comes in to understand that is the focus. Because I think, it would be different to have, here come a group of people I've never met, and they're going to be coming in and out of the house.
Right.
Oh my gosh. But we build those relationships, and we're very intentional about building a positive relationship, fostering that trust and rapport. And again, there's one more reason to have us come in as early as possible, so you do have as much say-so as possible. Another one of the main supports is that having that nurse 24/7. So if something goes on, typically, and it always happens this way, right? Things may not show up between 8 and 5, Monday through Friday. So maybe it's going to be after 5, maybe it's Saturday afternoon, Sunday at 2 a.m. But you don't have to worry about calling EMS, heading to the ER. Should we think about what we're going to get exposed to in the ER, all the things that come with that, when we can provide symptom management right there in your own home, and you never have to go anywhere. So, for some, that is a big change in their mindset, right? Because if you've dealt with a chronic condition and maybe that's been your history, is popping back and forth to the hospital, that may be a change. But what a relief to not have to do that.
Right.
So that would be tremendous for me.
And I agree. And, it could be something even smaller than that if you need a refill on one of your medications. Well, you don't have to try to get someone at the doctor's office or call the pharmacy, and depending upon what the medication is, it could be that somebody's going to say, no, we need to see you before we refill that. When your hospice nurse is taking care of all of that, that's not a concern. She's going to take care of getting the refill done, and you don't even have to pick up the phone.
Right. And when you think about our beautiful volunteers that we have, in addition to the team that's in the house, so they know, but just in case, maybe there's a new medicine, or maybe somehow we forgot to tell the nurse, oh my gosh, we need another box of gloves, or we need some pads for the bed, or whatever. Our beautiful volunteers are calling on Thursday to make sure everybody's got everything they need and they're tucked in for the weekend. Exactly. And so then there's another check, if you will. So we talk about all the physical, and I've been a nurse forever, but that's how I'll always view things. We talked about the nursing, but there's a lot of independence that's not physical, right?
Right.
Emotional, spiritual. What do we do to support people along those lines?
Well, again, we've got fabulous social workers, we've got wonderful chaplains, and they're both there for the social support, psychosocial support, the spiritual support. It could be that someone hasn't been able to get out to church in a while, or maybe they have a new minister in that time that they're really not familiar with. Mm-hmm. And so, the chaplains can step in. They're not there to take the place of your minister that you've known for 25 years. It's in addition to. And that we are in the Bible Belt, and spiritual support is important. It would be important to me. So knowing that just because you haven't been to church, or just, that there isn't going to be any spiritual support, no. That's where our chaplains step in.
Right. And again, you're back to choice. If you choose to have that service and that support or not. If you choose to have that at the beginning of your care with us, great. If not, they can always come in later, or not at all. But I think it's important too, for what may be termed unchurched. Maybe you don't have a church. Maybe that faith-based part of your spirituality is not as important in your life. So I think it's important for people to hear that our chaplains it's a non-denominational. They are not there to preach. Mm-hmm. They're there simply to support.
Right.
And again, where that patient is, right? Meeting the patient where they are. Mm-hmm. So it's never about us. It's always about the patient. Thinking about social workers and chaplains, I think it's important to note too that we look at the whole family. You know, caregiving is extremely stressful.
It's the hardest job anybody will ever do.
Right. Usually with little to no training. Right. So I think that is a huge benefit of our services is that caregiver, whether it's a spouse, an adult child, whoever, but then they can play that role, let the burden of a lot of the caregiving be on us, if you will, but then knowing that your caregiver gets the support too from our team.
Absolutely. And, you know, going back to on-call, thinking about caregiver support, it could be that it's not a crisis, but the caregiver has a question at 10 o'clock on a Friday night about maybe it's giving the medication, maybe it's a new medication. But rather than thinking, I don't have anybody I can call, no, all you have to do is pick up the phone.
Right.
But our folks they're teaching the caregiver. It could be that, you know, they've never had to think about safely helping someone transfer from the bed to the chair. And if you don't know what you're doing, that's a really easy way for the caregiver to wind up with a back issue or, you know, some sort of injury. And when you've got highly trained and skilled folks to teach and to show you how to do these things, that education is invaluable. And again, what a relief knowing I don't have to know all the things.
Right.
These nice folks know all the things and they'll teach me.
Right. And there for consistent support.
Yes.
Right. You know, when you think about, because like you, I would like to be in my own spot with my mini schnauzer tucked in beside me on the couch like we do every night. And my family there, not within a hospital, all the noise, all of those things. But if you think about staying in your own spot, maintaining your own routines, maintaining relationships in your own home while you're being cared for, that would have to improve your quality of life. So it's not just about symptom management, of course. It is quality of life is huge. And we've had so many folks that we have supported in such unique ways when you think about what's important to them. Last trips to the beach, knowing that we can get a travel contract with another hospice in case you need something while you're there. And then when you come back, we'll pick right back up. We have had trips out with the boys to a favorite restaurant that may be a couple of hours away. We have supported weddings. We've supported baptisms. We have helped improve quality of life until that great-grandchild gets here. All the things that it's just what life is all about. And that's part of what makes our service, I think, so incredibly beautiful, because it is so individualized and just support.
Right. You know, what's important to you? Talking about the trips and I always think back years and years ago, we had gotten a referral on a patient, and the social worker and the nurse went out to do the admission, and they got to the home, and you know the wife was there and some of the children were there and so and so and so, and there was one key player missing, which was the patient. He was on the golf course. Now, don't misunderstand, he was no less appropriate than someone that that was bedbound, that we were going to admit. But, you know, playing golf with his buddies was very important to him. And under our care, he continued to be able to do that for quite some time. Now, there might have been days that he just rode around in the golf cart with them and didn't swing the club.
Right.
But he was still with his buddies on the golf course doing what he loved to do. Yep. And you can't put a price on that.
You absolutely cannot. No, you cannot. So let's talk about choice in a different way, though. We've talked about how we would want things to go as far as our care, but what about choice of hospice? That's a different twist on patient choice. I think sometimes people are still surprised. We're not surprised because we think about this every day, but I run into people in our community that are still surprised. What do you mean there's more than one hospice? Mm-hmm. Are we all the same, Flavel?
No. Not, well, only in that, apples and oranges and avocados are the same.
Right.
But there is a difference. And, for us, for many years, we were hospice Rockingham County. In 2023, had to stop and think, in November of that year, we rebranded to Ancora Compassionate Care. And we have emphasized from that day forward that it was truly a rebranding and a renaming. We have never merged with anyone. We're not part of another system. We're still the independent nonprofit agency that we've been since 1987. Probably 40 years ago, the groundwork was laid from a grassroots effort. I think there were 33 folks on the original task force that got together and said, we need a hospice in Rockingham County, and how do we go about doing that? And so probably about 2 years worth of legwork and paperwork and meetings and whatnot, Hospice Rockingham County came to be. So we are truly, as Ancora Compassionate Care, the local provider that has been in this community for almost 38 years. And I think that is invaluable, knowing that we are the agency that has been serving friends and neighbors for decades.
Well, and it makes sense when you think about local taking care of local, because we listen to this community. I think that's part of the name change too, because by listening to the community, we have met other needs. So we don't just provide hospice care, we provide serious illness care. Now we have our own counseling center. So by listening and meeting those needs, but I think we're so in tune with this community because it's our community too.
Right.
So when you think about other hospices serving patients in this county, which certainly does happen, but people may not realize that some of those hospices, you mentioned nonprofit, that is what we are. There are some for-profit hospices from far away that are serving this community. Certainly not making a statement about the care they provide, but I think it's important to know that there's a lot of private equity that is poured into those hospices. So when you really think about it, it makes me think about, well, who are you going to please first? Your shareholders or the people that you're taking care of.
Right.
In all of our years since 1987 in the hospice realm, we've never turned anybody away that was medically eligible for hospice just because they did not have insurance or they had no way to pay for our services. So that is definitely, we're so mission focused.
Yeah,
that's a huge differentiator, I think.
It is, and I think that speaks directly. We take care of the community, and we've never turned a hospice patient away that needed care. And the community takes care of us because if not for that support, for fundraisers and donations and memorials and things like that, we couldn't make that claim.
Agreed.
For instance, last fiscal year, we provided almost $215,000 in charity care. Mm-hmm. We couldn't do that without the support of the community.
Right. It really is one big, beautiful circle of care, right? Folks, the community gives to us so we can give to those that we haven't even met yet.
Right.
Yep. So that is beautiful.
Right.
One thing that I want to get back to patient choice as we kind of wrap up, knowing there are other hospices that are out there. I think we have to be empowered ourselves as potential patients or family members that may need our services. Mm-hmm. I want people to understand that they have a choice, but they can ask for us by name. So let's talk about where do some of our referrals come from that would be important?
Physicians' offices, hospitals, those are the main two that come to mind immediately that you could, we're going to make a hospice, we're going to make a referral to. And we always want people to know that if they're making a referral and it's not to Ancora Compassionate Care, and that's who you want taking care of you or your loved one, you have the right to say, no, we would rather be referred to Ancora Compassionate Care. It is a little bit different in the skilled nursing centers in that we need to be contracted with them.
Sure.
And we are for the bulk of the places here in Rockingham County, we are contracted with them. But it is your right to request the provider of choice.
And that's important to know. So there's your freedom, there's your independence again, because we have heard from some families that they were in a hospital system and they said, well, we didn't necessarily get a choice. They came in and they said, well, we've got it all set up, you don't have to worry about anything, and they called ABC Hospice. But you do have a right, even if that happens, to say, thanks so much, but our choice is. We're very proud of the fact that we are the only 5-star hospice organization in serving Rockingham County. That is tremendous. That's our star rating from Medicare. Quality metrics all above the national averages, so we're extremely proud of that. Back to choice, we talked about referrals coming from physicians' offices, coming from hospitals, but something else that people may not think about, I think it's important for us to help people understand that they can do what we call a self-referral or a personal contact referral. If people in the community say, hey, I don't know, maybe they've got some support for us that would be helpful, just pick up the phone and call.
Right.
You don't have to wait for your physician. You don't have to go back to the hospital and have them make the referral. Anybody can pick up the phone and make a referral.
And, by doing that, you're maybe unknowingly taking some of the legwork and the pressure off of yourself, because once you make that referral to us, then we'll take care of contacting the physician, getting any orders we need, so on and so forth. So one call to us, we can take care of it.
Yep.
And knowing that if you've called and said this is what's going on, maybe if they're not medically eligible for hospice yet, then our serious illness care program can be of benefit and support until it's time for hospice.
Sure.
So we're still there supporting you, it's just in a little different way.
Exactly. And throughout all of that support, helping you stay where you want to be. So please know, it's all about patient choice, and when you need care, need support, and you want 5-star care, please make sure to ask for us by name, Ancora Compassionate Care.